Hey, everybody. This is Dr. Jess and Paul Burgess, the Great and Powerful. And this is another installment of our new podcast. Today, we're going to discuss mast cell activation disorder, histamine issues, and the like. This is a very timely issue because many people have histamine problems, and it is being diagnosed as mast cell activation disorder or one of the other similar diagnoses. So I know, Paul, you wanted to talk about this today, so go for it.
Yeah. So you know what it was? I had a very difficult conversation with the patient yesterday and had to ask her to move out of her house. It was a little bit insane because she got a mold test back, which was so off the chart that there wasn't another option. If I tried to treat her for mold, it would have been like her standing in a swimming pool and me giving her a towel and saying, dry yourself off. Right? It was never going to happen.
Exactly.
And sadly, I had to ask her to move out. Right? But she's been sick for 10 years. She's only 30 years old. She's such a lovely, lovely girl. And she's got so many multiple different things going on. And we've decided to treat her in a certain way, and things are going to work out for her long term, and that's great. But some of the things that other patients are facing are knowing what to treat first when we come up with these things. And so when people have got this complex set of cases, all of which are quite severe, so you've got like Lyme and mold and Epstein-Barr and some bacterial, viral, whatever it is, the bottom line is that the mast cell activation is needed to be calmed down first before you can start maybe doing some other work. So my question was going to be, what's your go-to for that? Firstly, do you agree? And secondly, what would be your go-to protocol maybe to say, this is how we want to reduce this? So that was the first thing. And then whilst I remember, the other thing, we see a lot of hay fever in the summer for a lot of people, and a lot of people get this hay fever out of the blue. They're like, I've never had it before, and now all of a sudden I've got it. That again is a histamine response. And one of the things that people aren't aware of is if your estrogen is too high and not being balanced and detoxified properly, that will push up histamine and you will get hay fever symptoms. So in my particular case, I remember my mother saying to me after my sister was born, which was 51 years ago, she developed hay fever. She'd never had it before, my mother. And clearly having a baby will mess around with your hormones somewhat. So
just slightly.
Yeah. So it is just interesting to know that it's not only underlying infections and problems that can cause it, it's also other things, but it's prevalent throughout. So anyway.
All right. Let's identify a couple of things first. Mast cell activation disorder. What are the mast cells? Mast cells are those little cells in the bloodstream that contain particles of histamine and heparin. Mind you, it's necessary. So when you get an injury, they open up, what's called degranulate, release heparin and histamine. So the cell walls open up and the serum and stuff can flood to the area, and that's your healing elements. Okay. Now, histamine has been demonized as being a horrible thing, but it's necessary in your neurological system. It's histamine makes your stomach acid go, stuff like that. Okay. It's when you're stimulating too much histamine to be created, okay, and you can't break it down very well, that you get this net high histamine. Now, the thing that I want to tell everybody is that mast cell activation disorder is, I know I'm going to get it for this, not a diagnosis. Okay. It is part of what happens in chronic inflammation.
It's a symptom, right? It is
a set of symptoms.
Yeah.
And the problem is people will go to the doctor, say, oh, you've got mast cell activation disorder. They will treat that with mast cell stabilizers, but never fix the issue. So the problem is, what do we do with histamine? Okay. So real fast, I am going to show you, without getting ostentatious, how histamine gets created and broken down. And then all of a sudden I'll tell you exactly what to do. This is my histamine pathway. Okay, forget all the pretty colors. okay, because I'm going to explain everything in a second. So when you're looking at this strategy report, anything that's in orange makes this enzyme work harder. Anything in purple makes it calm down. So we create histamine from histidine. Things that will calm it down is having too much histamine, because that's our feedback. Green tea, grapefruit, coffee, quercetin, curcumin, things that make histamine become created more are hydrogen peroxide, bile, inflammation, infection, high stress, exercise, lack of sleep. So when we get histamine created, it has to go into storage, mast cells, basophil, platelets, and the like. Now, the release of histamine is guided by stimulation of any of these four receptors. But generally speaking, the increase in histamine release, just like Paul just said, will be caused by increased dopamine, estradiol, and mostly inflammation and infections. Okay. Generally speaking, you want to calm it down. Theanine, curcumin, urtica, quercetin, rutin, astragalus, vitamin C. Now, histamine is broken down in two pathways. You can go outside the cell, and it's broken down by diamine oxidase, which is DAO, which creates an aldehyde. And this big fancy thing, this is aldehyde dehydrogenase, breaks it into acetic acid. So think of this as formaldehyde, and this is vinegar. This gets out of the body real fast, okay? But a lot of places in the body, we are actually creating an aldehyde, which is fairly toxic. So if it's outside the cell, diamine oxidase, and you need things like copper, calcium, and water to make it work, and here you need zinc and B3. Inside the cells, this enzyme called HNMT breaks it down to an N-methylhistamine. MAO-AMB breaks it down to that aldehyde again, then to acetic acid. So here you need SAMe, B2, zinc, and B3. When you can't break your histamines down, okay, and you're producing a lot because it's being stimulated, that's when you get a high histamine and you get what's considered mast cell activation disorder. Now, there's several ways of dealing with this. Okay, you're going to see that things that slow down the function of these enzymes, aside from certain food types, increased estradiol, okay, smoking, caffeine, being male, acute high stress, inflammation, always think inflammation, infection, and so forth, okay? What you need to do to stabilize the mast cells and help break down the histamine is to have a combination of all the cofactors here that will allow these pathways to work. You know, you can't change your genes, but you can influence how they work by giving them the cofactors. There's a couple of things that'll do this. Number one, Seeking Health just came out with a product called Histamine Block Plus, which is the DAO enzyme and all the cofactors you just saw there. Okay, so no matter what's going on, okay, it will usually help the breakdown of histamine. Two, quercetin is a mast cell stabilizer. Okay, fairly high doses of that and vitamin C, okay, will help stabilize the mast cells, okay, or stabilize your histamine, actually the mast cell. So there are the places where histamine comes from. Other side of the coin, why are you kicking up so much histamine? Food intolerances, leaky gut syndrome, okay, food intolerances, infections, stuff like that. So if you have to work on both sides of this particular equation.
Yeah.
You can help the breakdown. That's going to help a lot. Okay. But if you don't answer the question as to why so much histamine is being created, then it's just going to happen again and again. Paul mentioned that, I got hay fever all of a sudden. Okay. Well, think about this. In your allergies, if you have allergies, think of it as a cauldron. Okay. And let's say it's 99% filled all the time. Okay. So as soon as seasonal allergies come along, that extra stuff makes it spill over. All right. If you were used to having maybe a 50% filled cauldron, all right, and a little bit of extra stuff in there wouldn't make it overflow. If somebody's getting hay fever all of a sudden at one point of their lives, then you have to figure out why that's gotten filled so much. Okay. Do they have more food intolerances? Is their system breaking down? If you look at the system, do they have candida? Do they have clostridia? Do they have anything that might be kicking up the histamine and building up all these allergies, so that when another one comes along, like, seasonal allergies, now all of a sudden they're getting symptoms when they never used to. Okay. If we look at it like that, if we look at it, let's break down the histamine well, okay, and look for the reasons why it's being stimulated, okay, you'll fix the problem.
The other thing that can be a concern with some practitioners or some treatment protocols is, if you are starting to treat toxicity or mold, or you're trying to remove something like a parasite or anything that's going to potentially cause more toxicity in the short term,
Mm-hmm.
and you've already got quite a lot of mast cell activation, high histamine, that's going to really ramp it up.
Right.
So sometimes either working on both of them at the same time, whilst you're trying to remove the mold, because mold is going to let off a lot of biotoxins, which is actually going to make things worse in the short term before you can get rid of it.
Absolutely.
By doing them both at the same time, you reduce the chance of your patient getting so much worse that they can't continue the treatment. Because that happens a lot, right? Where people get so bad and they go, I can't do this, it doesn't agree with me, it's making me feel bad,
right.
I've got to stop. The trouble is, when you stop, you don't cure the issue. So you need to know how to make sure that you take that.
Well, that's all. First of all, those are clinical decisions. Okay. Your practitioner hopefully is astute enough to know how toxic you are, and then decide on a course of treatment that's going to minimize these die-off reactions, also known as Herx reactions, Herxenheimer reactions, and so forth. It's really, really easy to throw a bunch of antimicrobials and stuff at somebody and make them have die-off reactions. And some doctors do that because, you see, it's working. And as you're, in hospital because you feel so bad.
Yeah.
Some people have been like this for a long time, and you have to spend the first month or so getting their cells working, getting their detoxification system working, getting their gut in order before you can add to the toxins by killing off the microbes. And now, granted, some people say, well, why do you do this and then, do that? Shouldn't you be killing off the microbes first? Well, listen, if they can't handle the toxins that they're already dealing with, okay, and you start loading them up on more because you're killing things, okay, and you make them more ill, aren't you making the base system worse? Aren't you making their physiology worse? Build up their physiology a little bit. Now, have I had to do it the other way sometimes? Yes. Have I had to do it, contemporaneously? Yes. But for the most part, people do very well if we do a basic protocol, a basic foundational treatment for month and a half to start getting vitamins and minerals into the cells and start fixing their digestion, start getting their, leaky guts in order, because that's the great creator and continuer of inflammation. And as that goes down, they can handle more toxins because their detox system's working better.
But do you know what, Jess? Here's one of the challenges. You said you just do a basic protocol. The reality is, it's basic to us.
Yeah, that's right.
It's not basic, mate. I promise you. Right? And we lose sight of that. No, but this is really important, because we lose sight of it. We talk to people very similar to ourselves, and we all think this is just normal and regular.
Right.
I put a post on Instagram at some point this week, last Sunday, I think it was. Basically just said, what health issues are you having trouble fixing? Right.
I was interested in what the response to that was.
Did you read the responses though?
I didn't have the time, so I was going to ask.
There was over 100 comments on there.
Wonderful.
Which weren't, oh, I can't lose weight, or I'm a bit bloated, or I can't sleep. It wasn't anything like that. They were all multifactorial complex cases, and who had tried everything, right?
Right.
So I've done this, and I've been to this person, I've done X amount of treatments and been through so many doctors and everything else. And they still had this big set of symptoms, and a lot of them had bloods to share and all the rest of it, right?
Wonderful.
And so I would look at it and go, well, okay, have you tried this? No. Where can I get that done? Where did you get that test? And what it proved to me was, we are really good at this. Okay, we are very good at what we do, and we're
Yes, I
so
think so.
good. The problem is we only talk amongst ourselves, and we think it's very
Yes,
basic.
that is true.
But here's the kicker: about 65% of those comments of people who could not fix their problems were from practitioners.
Yeah.
But they were trying to fix their own stuff and they couldn't do it. And the purpose of the exercise was to prove to people, look, this stuff is complex and you need the right help for it. And you've been through all this help and nothing's worked. And I'm looking at this, or you'd look at it and go, well, have you tried this and this? Because they seem like the culprits in this scenario. And people are like, oh my God, that's a revelation. And it's not because we're hiding this stuff. We're telling everybody to listen.
We've been putting this stuff out free for a long time.
People aren't getting the message quick enough. So it's really important that if we say it's a basic protocol, it's basic to us, but it can be life-changing to other people. And
that is true. That's
not trying to be like, look how great we are. It's trying to just get the message across that don't suffer in silence and be sick, because there is help. And that post just proved how many people are at a dead end.
I was curious when you put that post out. I was going to say, gee, I was going to look for it and then just got busy doing other stuff. Something this is not being disparaging to the practitioners out there, but most practitioners practice a specialty. Okay. And the unfortunate part about whether it's a medical specialty or a mimic specialty by natural practitioners, the fact is that they tend to just look at that one area and work by protocol. So
they stick to what
they don't look at everything. Okay. Yeah. And what we do, what the real difference is, what we do is we look at everything. The reason we can be good when somebody comes to me, and this is all the time, and they've been here, there, everywhere, and I'll just ask them, what have you done? Bum, 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 bum. And it paints a picture of what stone's been left unturned. Okay. Very few practitioners will take the time to look at the extreme big picture. Okay. Because even in complex multifactorial chronic illnesses, there's a history, there's a timeline, there's something you can see. And from our position, we find it rather easy to see where the stones have been left unturned. But I will share with everybody what I often see. Okay. We just talked about the basic protocol or the foundational protocol, the bioterrain protocol. Something? They're not really protocols. They're just, I say that because the word comes out of my mouth, but it's the concept of actually getting vitamins and minerals into the cells, actually repairing the cell membranes, actually making sure you can get your nutrients and that your antigens that are being created aren't going through the gut membrane to hyperstimulate the immune system. Something? That is not even complex. That is what everybody should be doing. And often I will interview somebody and they'll say, oh yeah, I treated my leaky gut. I'm like, yeah, what'd you do? Well, I took probiotics. And
maybe if it's advanced, they might have taken some glutamine.
Right.
But then they got really cranky about it, and they got really on it.
Glutamine's creating glutamate, which is not converting to GABA. That's why I almost never use it. Although it's important for the gut, unless your system works, it's not going to work well for you.
The best thing to do. Yeah. So that's why, and that basic simple protocol that we use is actually specific to everybody individually.
Oh, it is. That quote unquote protocol. Remember, but by the way, people, protocols, and I'm talking to the practitioners out there, protocol should be a jumping off point, not an end unto itself. Yeah. So I know, and so does Paul, tons of protocols. So what we do is take, oh, that's good here, but you pick it and you construct it to that individual patient and the individual patient's physiology. Okay. We have some go-to things. Huh?
We have just put together one of the most comprehensive and powerful
biotoxin protocols. Yeah.
Basic biotoxin protocols that we could put together between us. Right. Which I think is phenomenal.
Yeah, it's going to work well too.
It has to be done at certain times, everything else. That's great. But there's also things that will be added and taken out of it depending on what that particular person is suffering from.
Yeah,
So it's never
exactly.
going to be like, that's the blanket one, take that.
No,
It's
and
about,
that's the problem with doing that. I like to call it lazy man's medicine, because if you just say to yourself, "Oh, they just need this," it's like going to a Lyme practitioner and saying everything's Lyme. Yes, if you only have a hammer, everything looks like a nail.
Yeah.
And the fact is that all chronic illnesses basically have the same symptoms. So whether you call it ME, or whether you call it CFS, or whether you call it fibro, or whether you call it whatever, okay, anything that results in chronic inflammation have very similar symptoms. So you can't work from the outside in. You have to work from the inside out. And sadly, I got to get going. It's like, but nevertheless, I got to tell you something, guys, people, listen to what Paul said. All right. Histamine or mast cell activation disorder is only a syndrome as a result of something. Yes, you can work with it. Yes, you can treat it. But if you don't treat what caused it, it's sort of like using a Band-Aid on something. Now, there's no dishonor in using a Band-Aid. The dishonor occurs when all you do is use a Band-Aid and you don't look for the source of bleeding. Okay. And I see that all the time. If you have to take, 2 shopping bags full of substances per day, and you're always buying loads and loads and loads of substances, and you stop it for a while and you don't feel well, you're not being fixed. If you take 5-methylfolate or methylcobalamin or something like that, and you have to take it for forever, you're not fixing the pathways. It's good to use it as a stopgap measure. Okay. If you're taking hormone replacement therapy because you're, postmenopausal, and if you don't take it, you don't feel well, guess what? Your gonads, the ovaries, aren't what's working and creating your hormones during postmenopause. It's your adrenal glands releasing DHEA, creating your hormones. So you can take that hormones for the rest of your life if you want, with all the dangers there, but fix the adrenals, make sure you got enough DHEA going, and you will naturally create your female hormones. Okay. So it's nice to treat things, but you got to get at the causes, and you have to get the body to work. I know we've been preaching this a long time. I don't know why our practitioners aren't really, embracing it.
It will happen. So, but if anyone is listening and they need to talk, help, anything else, both of us, you can go to either of our websites,
Right.
drjessarmin.com, paulburgess.uk. There are buttons at the beginning of it, free 30-minute chat. It's never 30 minutes. It always takes me an hour.
Yeah, me too. When I get interested in something, I just yammer. Okay, but between Paul and I, and we both practice the same way, and we know each other for a very long time. So it's one of these things where we will take the time, and that's the difference. We'll take the time to figure it out, and then once you work with us, and you're working with us on an ongoing basis, that process continues, so that it never just sits in one place. It's a constant figuring out what's wrong, going to the next step, figuring out which way to go, going to the next step. And I just talked to a patient the other day who said they spent $2,500 for 3 months with a practitioner. And I said, okay. I said, can you just tell me what's offered there? Well, 2 visits, 2 consults. She had to pay for all the other tests, where our tests are included. She had to pay for all the tests and all the nutraceuticals. And for $2,500, got 2 consultations, nothing else. That was one, the other, that's it. Okay. Yes. We have ways of getting in touch with us. We have weekly or every other week visits, and constant communication when we need it. Huh?
But some patients will message me 3 or 4 times a week if they need to. So that's great.
Right. It's all dependent on, I write, once a week for the first 4 to 6 weeks, and then every other week. But there's been people I talk to every week. There's some people I talk to twice a week. Cool. There's some people who only need me every other week, but that's more than the other practitioners are doing. And we're following them along. And that's why we're really successful at this type of treatment. Gotta run, guys. Right. Take care. Take care. Bye-bye.